ବର୍ଷକୁ ବର୍ଷ କାୟା ମିଲାଉଛି ଡେଙ୍ଗୁ। ମିଳିତ ଲଢ଼େଇ ପାଇଁ ପ୍ରସ୍ତୁତ ବିଶ୍ୱସ୍ତରୀୟ ରଣନୀତି। ଜଳବାୟୁ ପରିବର୍ତ୍ତନ ଏବଂ ଦ୍ରୁତ ସହରୀକରଣ ଯୋଗୁଁ ଡେଙ୍ଗୁ ଏବେ ବିଶ୍ୱସ୍ତରୀୟ ସ୍ୱାସ୍ଥ୍ୟ ସଙ୍କଟ ଭାବେ ଉଭା ହେଉଛି। 2024 ମସିହାରେ ସାରା ବିଶ୍ୱରେ ରେକର୍ଡ ସଂଖ୍ୟକ 14 ନିୟୁତ ମାମଲା ସାମ୍ନାକୁ ଆସିଥିଲା। टीकाकरण एवं परीक्षण क्षेत्र में किसी सफलता मिलता डेंगू एपर्यंत कौन सठिक व अनुमोदित चिकित्सा नहीं। यह शून्य स्थान को पूरण करने वैश्विक अनुष्ठान डेंगू अलायंस आगक आसी सरकार शिक्षानुष्ठान एवं शिल्प जगतर मिलित सहयोग में डेंगूर चिकित्सा एक नूतन पाइपलाइन प्रस्तुत करा जाउछि। भारत में ICMR AIIMS एवं WHO विशेषज्ञ माने एकाठी होई डेंगूर समाधान पाई बड़ रणनीति प्रस्तुत करिसेंति।
I think what the Dengue Alliance brings to the table is the idea that the discovery to delivery pipeline need not be sequential or siloed. It can be really a partnership which can be integrated by multiple people coming together, and this whole thing need not be happening in a sequence. It can happen parallelly, and that probably is the best way to accelerate the science to make a viable product which will be put to clinical use. The other thing that the Dengue Alliance also brings to the table is that for the first time, I mean, there are many diseases where people work, there is north-south collaboration, but this is essentially a south-south collaboration. So this really brings together the people who are whose countries are suffering the brunt of the dengue epidemic.
According to WHO, before 1970, there was just about 9 countries which were endemic for dengue. As of 2025, that number has gone up to 100 countries, putting nearly 4 billion people at risk. All this is being increasingly driven by climate change and rapid urbanization, which are sort of fueling the transmission of the disease. So what was once predictable is now volatile, and what was once contained is now spreading, and spreading really fast. We are also seeing this crisis reflected in the numbers. 2024 was the worst year on record for dengue globally. There were nearly 14 million cases that were reported, and over 10,000 deaths globally.
ICMR सूचना अनुसार देश में स्वदेशी डेंगू टीकार तृतीय पर्याय परीक्षण जारी रही। जापान टार्गेट टीका आमदानी अनुमोदन मिली। विभिन्न स्वास्थ्य भित्तिक योजना एवं वन हेल्थ मिशन माध्यम सरकार यह प्राथमिकता देउछंती। तेबे चैलेंज कम नुहे। कम रिपोर्टिंग, दुर्बल निरीक्षण व्यवस्था एवं पांठिर अभाव लड़ाई को आहरी जटिल कर देउछि। डेंगू सहित जिका एवं चिकनगुनिया भली भाइरस सहसंचार स्थिति को अधिक भयानक करिछि। तेणु केवल टीका नुहे बरं कोल्ड चेन व्यवस्था एवं सुलभ चिकित्सा पहुंचाइबा पई एक सामग्रिक आभिमुख्यर आवश्यकता रहिछि बोली कहिसंती खु विशेषज्ञ।
Coming into a public-private partnership and going into a collaboration with Panacea Biotech to conduct the phase 3 trials in India for an indigenous live attenuated vaccine for dengue, which is a tetravalent vaccine again, and also recently a nod from CDSU, a SEC nod for importing Takeda vaccine, which is there globally, as Suman sir was mentioning. So I think these are all efforts in that direction. And to just give you an update of the dengue vaccine, that phase 3 trial has been initiated with ICMR. So it has more than 10,000 study participants, and the recruitment has already been done. And now the follow-up is going on. So it is again, re-emphasizing our resolve to address the issue.
We have the situation of the dengue vaccine discontinued. We have the vaccine, the Takeda vaccine now with the exemptions being introduced. We have the news in Brazil with the Butantan vaccine now registered and being deployed. At the same time, challenges when we look at the age groups that are covered, their variability in different contexts. some of the epidemiological uncertainties that have been already pointed out. And when we look in terms of diagnostics, also a number of them in terms of their availability, but also in terms of how well designed, and actually some improvements that that would be requested and required. Also in terms of needs, in terms of better risk stratification tools. Enormous progress in terms of the Wolbachia, the vector control strategies.
डेंगू विरोधी এই যুদ্ধরে বিশ্ব সহযোগ এবং চিকিৎসা নবসৃজন হি একমাত্র রাস্তা। যদি সময় থাউ থাউ অর্থ বজেট এবং উপযুক্ত রণনীতি কার্যকারী হুয়ে তেবে আগামী দিନରେ এই মহাসংকটକୁ ରୋକା ଯାଇପାରିବ। ବ୍ୟୁରୋ ରିପୋର୍ଟ, କନକ ନ୍ୟୁଜ୍।